When ProImage is first launched, you get a window like you see here with a patient window which comes up. There are a number of things that you can do from this main navigation window. You can create a new patient, delete a patient. By pressing this button, you go into the acquisition mode for acquiring dental radiographs. You can access a database of a given patient. The patient is listed in this window. You have a drop-down list of all of the patients. The main screen basically makes this patient window disappear so that you can access these main drop-down menus that you have up here, the File, Edit, Preference, Tools, and so on. You also have a search button here, which when pressed brings up search criteria. So you can toggle the searching on and off with that. So the very first thing you want to do after you've installed this program is to put in dentist information. That's the first. And then secondly, you want to put in patient information. So we'll go over that. By going to the main screen, it allows me access to these main menus. And the file drop-down menu is a very powerful one. And in it, we have Open Patient Database, Add New Patient, Update a Patient, and here we have Add a Dentist. So I'm going to click on that, and I'm going to put in a dentist here. And an ID. And normally you would add the rest of this information. We don't really have to do that. And I can add the dentist or update if it's pre-existing dentist. I need to change some of this information. I can do that here. But here I'm just going to add the dentist. And notice it says here that it's been added to the database. So at this point I'll exit. The green triangle up in the left corner brings up the patient window. So that launches that window back. And again, from here we can do quite a few things. Also, when we want to go into the acquisition mode to take radiographs, we want to have a template or a tooth chart that we're going to put the radiographs on pre-selected. So we have a number of pre-built charts here. And the first one, probably the most common and most likely the most useful, is the full mouth exam horizontal bite wings, 18 positions. So we're going to click on this button now. And we're using demo patient A, and after a full mouth series is done on a patient, you will typically see something like this. These upper rows here of teeth with the roots pointing up represent the upper teeth or maxillary teeth, and mandibular would be down here on the bottom, and in the middle we have the bite wings. I believe that is for showing occlusal surfaces here. Now this chart, this is one of the most important things that I want to emphasize, is the fact that this chart represents a patient facing you. It's like you're face to face with the patient. So on our right over here, that is the left side of the patient's face, and on our left that represents the right side of the patient's face. The positioning of the sensor in these examples, these 6 examples to our left, which is the patient's right, are in what I call landscape orientation. In other words, the long dimension is left to right and the shorter dimension is top to bottom. These, starting near the front of the mouth, including the incisors, are in what I call portrait orientation, meaning the long dimension of the sensor is up and down and the shorter dimension is left to right. In all cases, you want the point where the wire attaches to be facing out the front of the mouth. So in this case of these 3 radiographs, the sensor was physically placed with the wire coming down, which is down from the front teeth, out the front of the mouth. And in this case, on the mandible, the wire is attached to the sensor here, and it's pointing up, coming still out the front of the mouth. On all of these to our right, which is the patient's left side, we're pointing the wire to our left, which is towards the front, again, towards the front of the mouth. And the wire would be attached here, here, and so forth on our left, which is the patient's right side, always attached facing to the right, our right, which is, of course, going towards the front of the mouth and out the front. This is very important because if you don't orient the sensor in this way, you'll get roots facing unexpected directions, and you might lose track of exactly where the teeth belong, which is not a good thing. So this is something that you definitely want to always keep in mind when you're placing the sensor in the patient's mouth, regardless of what positioning aids you may be using, that kind of thing. So for now, I'm going to exit this chart for a moment. I'm going to go to the main screen here, and under the Tools menu, we have something called Chart Designer. Now, the Chart Designer, I'm bringing it up now because this ties in with what I was just saying about the chart. This arrow is pointing towards the point of attachment of the wire. And again, this is our left, which is the patient's right side, and the point of attachment is on the side of the sensor that's leading out towards the front of the mouth, which is around here. So again, the wire is attached here, 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 and so forth, here and here, and it's always, the wire in this case is going this way. Over here, the wire is moving this way towards the front of the mouth, down and up. Up from the bottom, down from the top, out the front of the mouth. We can also make a new chart. We can create our own charts, but we cannot change or modify any of the pre-built charts. But if you want to take a pre-built chart, you can make a brand new chart that's very similar or based upon an existing chart, and you can copy it basically this way by just making your own. And it is important to note that you're going to want to rotate these positions so that basically so that they're correct. It should be like that. To our left, pointing towards the front, top, portrait pointing towards the front as well. And then we can save this and give it a name. And very important thing to understand about the Chart Designer, whether or not you even make a chart or not, you can always go into the Chart Designer. I'm going to cancel that. Sure, you want to cancel yes. Is the fact that full mouth exam, horizontal bite wings, happens to be order 1. That means it comes to the top of the stack when you're in the patient window. So if you're using another chart and you want it to come up and be prominent, be the first one that comes up, so you don't have to look for the teeth that you've radiographed, you can always change the order. For instance, I can go to, say, bite wings here, which is number 2, and I can change it to order 1. So now the full mouth exam is number 2. Now I can change full mouth exam back to 1. So that's a very handy feature to be aware of. I'm going to close this for now and relaunch patient window. Go into the acquire mode. And basically we have, I'm going to choose another patient here. I'm going to choose this one. So here's our new patient. We have no teeth radiographed yet. We have the standard mode, which is for taking a sequence of teeth, and we have what's called the endo mode, which is for taking basically root canal therapy, but it doesn't have to be restricted to the use of one tooth. You can actually choose or move the sensor to different teeth because you have the ability to drag and drop images from one location to another.